Now another example is toll-like receptors. Okay. Now another example is toll-like receptors, if you ask me. Now another type of enzymatic receptor is Janus kinase receptor. Janus kinase receptor, or in the short form it's called JAK receptor. Now examples, what are the examples for Janus kinase receptors? Guys, Janus kinase and tyrosine kinase are enzymatic type of receptors. Okay, just remember, enzymatic receptors are further classified as tyrosine kinase receptors and Janus kinase receptors. Tyrosine kinase receptors, I have just given you the examples, right? EGFR-V, EGFR-HER2, insulin, IGF and toll-like receptors. And if you ask me Janus kinase receptors example, these are leptin receptors are Janus kinase. Next, growth hormone receptor. Next, prolactin. These three are Janus kinase or JAK type of receptors. And another enzymatic type of receptors are guanylate. Wait, I'll just write it in another page. It's better we write it in another page. I will better write it in another page. Okay. Now another type of enzymatic receptors are guanylate cyclase receptor. There are two examples in guanylate cyclase receptor. First one is ANP, atrial natriuretic peptide. Remember where it is. This one is very important. It can be a potential MCQ. Second example is BNP, brain natriuretic peptide. Right? These two examples are very much important, right? And guanylate cyclase receptor is a type of enzymatic receptor. That's as simple as that. And fourth type of receptors are GPCR, G protein coupled receptors. And I don't think I should write the full form, but just remember G protein coupled receptors, GPCR. In G protein coupled receptors, there is a further classification, right? First one is GS type of G protein coupled receptors. What this GS type of G protein coupled receptors do and how do they function, right? What happens is, if these GS type of receptors are stimulated, what happens is they in turn stimulate the adenylate cyclase. How do these GS receptors works? They stimulate the adenylate cyclase, thereby causing increase in cyclic AMP. This is very important, doctors. Please remember this mechanism. I am saying once again, please remember this mechanism. This is very much important. When GS receptors are stimulated or initiated, they in turn stimulate the adenylate cyclase. What happened? These GS receptors work by stimulating the adenylate cyclase, thereby causing rise in cyclic AMP. Now this rise in cyclic AMP brings about smooth muscle relaxation. This is the mechanism. Smooth muscle relaxation. So what happened? If GS type of receptors are activated or stimulated, it leads to smooth muscle relaxation. Remember this, very much important. Example where we can see in bronchodilation, and we also see in cardiac and skeletal muscle contraction, right? Now what are the examples of this GS type of receptors, right? So these all actions occur if cyclic AMP increases, smooth muscle relaxation occur, bronchodilation occurs, cardiac and skeletal muscle contractions occur. So if GS receptors are stimulated, you get all these types of action. Now what are the examples of GS type of receptors? Beta 1 receptors. Now these beta 1 receptors, if they are activated, they leads to cardiac muscle contraction. So that implies if beta 1 receptors are stimulated, it increases the cardiac activity. So this is the principle that is used by dobutamine in congestive heart failure, right? So this dobutamine, it simply acts on beta 1 receptors. These beta 1 receptors which are initiated in turn cause the increase in cardiac muscle contraction, thereby leading to betterment of the cardiac activity. Now these GS type of receptors are also beta 2 receptors. Beta 2 receptors are also GS type of receptors. Now where in the body will see beta 2? In lungs. If these beta 2 receptors are stimulated, it leads to what it leads to? Bronchodilation. So previously we already studied that GS receptors when initiated cause bronchodilation also. So beta 2 receptors when initiated cause bronchodilation. So this is the principle that is used by salbutamol, which is used in asthma. Now you understand this. So doctors, that is why I say concepts are important, not questions. Questions are not important, concepts are important. You have the right concept, you can easily solve the MCQs just within a fraction of seconds, just like that. Okay, now we'll go to the next page, right? Now cyclic AMP is metabolized. Just note down this in a corner or in a small copy page. You just write down this. Cyclic AMP is metabolized by, previously 2021, this is an INSCT MCQ, is metabolized by PDE3 or 4 in bronchi, right? So just simply I will tell you one simple mechanism, you just understand. What does the cyclic AMP do? Cyclic AMP causes bronchodilation. So who will metabolize the cyclic AMP? Cyclic AMP is metabolized by PDE3 or PDE4. Means, if in simple words, cyclic AMP is destroyed or break down by PDE3, phosphodiesterase. PDE3 means phosphodiesterase. PDE3 means phosphodiesterase 3 or 4. So cyclic AMP is metabolized by phosphodiesterase 3 or 4. Now just understand this concept. Now if cyclic AMP is metabolized, will bronchodilation occur? No. So can this principle be used for our pharmacology, better for our pharmacology uses? Yes. This is the principle used by theophylline. This is the principle used by theophylline, which is a PDE3 inhibitor. Phosphodiesterase inhibitor is theophylline, which is used in asthma. So what does the theophylline do? Theophylline inhibits the PDE, phosphodiesterase. If the PDE is inhibited, can the cyclic AMP be metabolized? No. So cyclic AMP will prevail for long time. Cyclic AMP will present for long time. So what does the cyclic AMP do? Bronchodilation. So the bronchodilation obviously increases. So if the cyclic AMP is preserved, means if the cyclic AMP is not metabolized, obviously the bronchodilation goes on. The bronchodilation can occur for long time. So this is the concept behind the usage of theophylline, which is a phosphodiesterase inhibitor. This phosphodiesterase metabolizes the cyclic AMP. Okay, you got this. Now what about phosphodiesterase in heart? Phosphodiesterase in heart. So PD is also present in heart. So this phosphodiesterase in heart is inhibited by, here also inhibition. This phosphodiesterase in heart is inhibited by milrinone. Milrinone, I wrote the spelling wrong. It's milrinone. Very important question. Milrinone acts by inhibition of phosphodiesterase in the heart, thereby increasing the life of cyclic AMP. This cyclic AMP causes what in heart? In heart, cyclic AMP increases cardiac contraction, thereby increasing the betterment or activity of the heart. So the PDE, phosphodiesterase in heart, is inhibited by milrinone. Very important MCQ for INICET. Remember this. Okay. So this milrinone is used in CHF, congestive heart failure. You got this? Now, so this is all about GS type of receptor. This is all about GS type of receptors. Now what are the other type of receptors? GQ. GQ is another type of G protein coupled receptors. What does the GQ do? What does the GQ do? What happens is, just please stay on.